Hello and welcome to another month and a short summary video of this month's blog. This month's blog is perfect timing as the Esquimalt pool just reopened where I work in clinic, and this month's blog is the benefits of pool therapy for cancer. We know generally that pool therapy just helps to help people feel better, help those with cancer to move easier, decrease pain, and improve their mental well-being. We spoke in a previous blog a few months back about water therapy in a different context, and this was cold water therapy. At the end of this video, you will see a link that speaks more to that protocol and the benefits of cold water exposure for those with cancer when it comes to managing neuropathies, neuropathic related pain, absence of energy such as fatigue and stamina, as well as joint pain, hot flashes, nausea, and many other aspects of the symptom burden that can be associated with cancer. And you can see that link below. However, this blog is speaking more to comfortable temperatures, which I'm sure you'll all appreciate. Simply just being in the pool, aquatic therapy, pool therapy, comfortable temperatures. First and foremost, we'll just note the physics of the water, because this is a very important part that's kind of neat to understand. We know that water has hydrostatic pressure, and hydrostatic pressure acts like a global brace for the body. It's just squeezing gently all of the joints and providing stability to our body. So this global brace is a nice little message of safety, and this is often why things can feel quite good in the water. So first and foremost, one of the first benefits is that pool therapy improves mobility. It does that because you have this kind of global brace around the body. You have that pressure from the water. In addition to that, you have buoyancy, which allows for decreased load on the joints. These two things coupling together, this extra support and decreased load, can free up movement and mobility that didn't exist before and doesn't exist on land. So patients really appreciate that. We know that regardless of the treatment phase, patients can benefit from pool therapy and receive similar benefits of improved mobility. I spoke in a previous blog on chemotherapy-induced peripheral neuropathies. An example of this is when the nerves kind of get sticky. Sometimes they're caught in the shoulder, called plexopathies, or in the neck. Sometimes it's more peripheral. Sometimes these are neuropathies induced by chemo. But regardless, these nerves can kind of get sticky. They're not moving very well. They're not getting a lot of blood flow. The water can offer new ways for these nerves to slide and glide and move with ease because they simply feel less load and more support in doing so. So it can be very powerful for that. We also know that generally sometimes hormone therapies can cause a lot of limitations for patients, such as joint pain and hot flashes or an exercise intolerance. And just because, once again, the pool is supportive and there's less load, this can free up mobility a lot for patients. We also spoke a little bit about post-surgery, that surgical phase where things are really stiff and painful to move. Once that wound is sealed, closed, we know it's safe to enter into the pool. We can also put on a waterproof bandage to assure extra sterility, but the pool can really free up a lot of movement in a post-surgical phase as well. So in all 5 phases of cancer rehab, it can be very beneficial. The pool therapy, as we talked about, can really help to decrease pain. It does this, as we talked about, with this force of kind of bracing and then less load. Your brain notices that things just feel a little bit safe. And when your brain notices that things feel a little bit safe, it is less reactive. It is less protective. So it's as though that alarm system just calms down a little bit. And when that alarm system calms down, we simply experience a little bit less pain. So post-surgery, radiation, and so on, the pool can really be helpful from a pain management perspective. It also can be helpful with the pain associated with chemotherapy. However, we need to be cautious from an immunocompromised kind of standpoint and do risk assessment accordingly. So I just mentioned here that we can also elaborate pool therapy into specific conditions such as bone metastases. This is a really exciting and neat area that I've seen and I have an honor to work with. Patients with bone metastases have the unfortunate event that the cancer is metastasized into their spine or into their bones. This can cause a lot of pain and a lot of intolerance to land-based activities. Walking can be too painful and very difficult, sit to stand, squats, just really limited movement. Sometimes patients with bone metastases will then go into the pool and experience pain relief that they've never had in a long time, and experience an ability to start working a little bit on their stamina. So pool therapy for bone metastases is a very powerful and can be a very helpful thing. And as we kind of spoke to and show in this picture here, pool therapy can just generally decompress the entire spine. So that can be a very powerful thing for patients to experience from a pain relief standpoint. So another benefit from the pool is that it improves muscle endurance and stamina. We know that there's less load on the joints, so you can move with a bit more ease, and you have that nice stabilizing force of the pressure. This means sometimes patients can even move with more speed, which is really exciting. So when you can move with more speed, with a lighter load, this starts to challenge your aerobic system. So this is where we start to build stamina. Stamina can then translate into improved ability to just handle life, handle walking, standing, sitting, and the day-to-day stuff. So pool therapy can really help those with cancer that are struggling with cancer-related fatigue. If you're considering a return to work and stamina remains a concern, the pool can be an amazing place to start to build the stamina so that when you do return to work, we've somewhat prepared that and ensure greater success from a stamina standpoint. Now, we spoke a little bit about muscle endurance, and I just want to compare that with muscle strength. So the one downfall of pool therapy is that it isn't great at promoting strength adaptations and improving balance. And that's the downfall of things feeling light and easy with less load and everything feeling nice and stable. We're not going to get those same strength adaptations that we would when we have to work hard against gravity. But instead, when we hold positions for a while and we push lighter loads for longer periods of time, we get muscle endurance. And that's an awesome adaptation. This too can translate into things feeling a little bit easier in the day-to-day, slightly improved postural endurance, and ability to just kind of handle the stuff around the house. So that's another great benefit of the pool, muscle endurance and stamina. We also know that the pool can help to reduce swelling. So we know there's that pressure, right? That can help you to move a little bit more with ease, your circulation benefits. And from that, that means that stubborn swelling is finally starting to move around and can be reabsorbed by the body. In addition, your muscles act like pumps, starting to facilitate, improve circulation, moving that stubborn swelling around. This can then kickstart pretty good and impactful lymphatic drainage. So all in all, another great benefit of the pool. So obviously, with improved circulation, improved muscle endurance, improved stamina, pool therapy improves cardiovascular health. We're working our heart and lungs when we work with lighter loads, moving in repetition for longer periods of time. So by getting in the water and starting a pool therapy program, you then also benefit your cardiovascular health. The research since 2021 has shown that basically the benefits of hydrotherapy are pretty universal. Yet so, patients do greatly benefit from the safety and clinical expertise of a personalized pool therapy program. So before starting any pool therapy program, consider a comprehensive cancer rehab initial assessment. So here at the Cancer Physio, we do offer personalized cancer rehab supports and tools that work all throughout the 5 phases of cancer rehab. And there will be a link at the end of this video to my blog about the 5 phases of cancer rehab and how they are each important. So last but not least, we know that pool therapy feels good. Often patients just get to move with ease, and that just feels pretty darn good. And that feeling good for that bit of time in the pool can translate into feeling a little bit better throughout the day, so on and so forth. So, at the end of the day, these journeys are so challenging and so individual, but a few more tools to help you feel a little bit good, a little bit better, it isn't a bad thing. So once again, thank you so much for your time. Thank you for your interest in science and rehab, and I hope that this blog summary was helpful. Take care. Till next time.